welcome to an exciting episode of Medgate Today Podcast, where we bring you the most insightful conversations from business perspective in the world of healthcare, pharmaceuticals, diagnostics, and medical devices. In today's podcast, we have Mr. Raju Vaishya. He is the Senior Consultant Orthopaedics and Joint Replacement Surgery at Indraprastha Apollo. Hello, sir.
Hello.
So, what inspired you to specialize in orthopedics and joint replacement surgery?
I became a doctor on the inspiration of my father, who was also a physician. Looking at his, healing touch to the patient, I thought of becoming a doctor, and I fortunately became a doctor. Then after becoming a doctor, I realized that orthopedics is one of the most fast and rapidly evolving branches, and a lot of people with orthopedic problems were actually getting disabled at that time when I became a doctor in early 80s. So I decided to do orthopedics. I became orthopedic surgeon. Then I realized that still there is a lot of vacuum in Indian orthopedics at that time, and hence I decided to go to United Kingdom for higher surgical training, where I did 4 years of higher surgical training in best of the centers. And then I decided to return back and provide those services to my countrymen, and that's how I am here.
So, sir, it's a long journey so far. So, over your career, what advancements in joint replacement surgery have you found the most impactful?
The most impactful things in joint replacement surgery, it is now very safe and reproducible surgery, which has success rate of more than 99%. Then newer techniques like 3D printing, robotic surgery, personalized care for the patient, pain relief techniques, blood loss reduction techniques have evolved that has helped in the outcomes of patients undergoing joint replacement surgery.
So, sir, can you share one of the most challenging or rewarding cases that you have handled so far? Like one of your top favorite ones?
See, I have done more than 10,000 joint replacement in my career, and there are various people, who have been quite challenging. One of the most challenging, I would say, was a 97-year-old gentleman who was the father of an anesthetist who was my student, and this patient happened to be the patient of my father previously in Gwalior. So he came to me that I want my joint replacement done because I am unable to walk for last 1 year or so. But I said, why do you want to have this surgery at the age of 93? So he said, because I wanted to do horse riding again. I used to play hockey with Dhyan Chand, and I was a very fit person. I was principal of a college. So I said, okay, let us investigate. He came all the way from Durg, which is in Chhattisgarh. So we investigated him and found that he has no major medical problem, even at the age of 93. So I had no excuse not to do his surgery, and I did his surgery successfully, and he lived up to the age of 100. So, age is, we consider biological age more important than chronological age. Somebody may be quite sick or ill at the age of 50 or 60, and some may be quite fit at the age of 90. So the longer they live, the more healthier they are. That's why they live so long.
Obviously, they say that age is, just a number for some people, and some people take it as a, big challenge.
So he was one of the person actually who influenced me, and it made a world record actually. It was listed in Limca Book of Records, and he had both knees replacement done at the age of 93. And to my surprise, after 6 months, he sends his wife for both knee replacement also, and we did that.
That's a great story, sir. It was, both emotional and challenging, and yet very inspiring also. So, sir, what innovations or technologies are you currently using in your surgical practices?
We are using the world's best for robotic surgery called Mako, and we are getting phenomenally good results. Apart from that, for joint preservation techniques, we are using a lot of joint preservation techniques like osteotomies, partial knee replacement, injections of platelet-rich plasma, stem cells, hyaluronic acid, and so on. And these are very, very effective way of preventing arthritis and postponing the need for major surgery like joint replacement surgery. In addition, a lot of knee braces are there which protects the joint and can help patients avoid any intervention for quite some time.
So, sir, coming towards the robotic assisted surgeries, how has robotic assisted surgeries changed the outcomes in joint replacement?
See, in robotic surgery, the surgeon does the operation, but robo helps. And robo also helps in preoperative planning, because exactly after analyzing your knee by CT scan, the images of CT scan, it can make a plan that how to cut a bone, how much bone needs to be cut, minimum bone resection, and what size of implant that you are going to use. So you know everything even before the start of the operation. And then you execute the plan which the robot has made and you have approved. And so chances of human error are totally avoided, and success rate goes to almost 100%. And it is a reproducible operation. It causes very minimal bleeding, very minimal pain, and hence faster recovery of the patients.
Definitely, sir. Sir, one more last question, sir. What changes would you like to see in the medical education, specifically in the orthopedics and joint replacement surgeries?
I think we should move away from conventional theoretical teaching of the students. Rather, it should be, work-based, to give them real-time experience of what they would be doing in future. Of course, they need an overview of the subject, but they must also be trained in the field of the areas of their interest. So if somebody is interested in, for example, knee surgery, he should be more focused on, taught on the nitty-gritty of knee surgery rather than teaching him spine surgery, for example, which he may not be doing in his life. So a lot of personalized modules needs to be created. And not only we need to teach them the surgical experience or training, but we also need to train them how to handle patients, how to communicate with them, how to avoid complication. If complication happens, how to deal with it, and all those things. In addition, very, very important thing is the clinical practice should be coupled with research. They should also do research in whatever they are doing so that they get the best out of it, and their patient also get the best out of it.
So I think this applies to all the kinds of education apart from the joint replacement and orthopedics. Thank you, sir. Thank you for your valuable time.
Thank you.
So this was Dr. Raju for us. Thank you, viewers. Keep watching and stay tuned.